Hello, everyone, and thank you for joining us for today's session, Advocates for Health Community Leader Lightning Talks. My name is Megan Kennedy, and I am the Director of Philanthropy Programs here at the Global Philanthropy Forum. I just wanted to take a minute and thank you all again so much for joining us for this year's conference, and especially for this session, which we are very excited about, being joined by two leaders in the health space who are doing amazing on-the-ground work acting as advocates and activists for change. While we can't create the in-person settings that we've enjoyed in the past, we are very excited about the format for this session, which will give you all the opportunity to meet both of these speakers after their formal remarks in the virtual lounge at the tables. So we will direct you there after these two speakers give their remarks. Unfortunately, due to a medical emergency, our third speaker, Juan Acosta, is unable to join us today, but we are very excited to have joining us Desmond and Diana Samarasan joining us for this session. And with that, I would like to introduce our first speaker for today, Desmond Dasa. For over 15 years, Desmond has been a watchdog snapping at the heels of errant companies, particularly major oil refineries, who have polluted their way through decades of industrial expansion in South Durban, South Africa. He is an internationally recognized environmental and human rights activist and has dedicated the past 2 decades to building collective and informed networks of changemakers through the South Durban Community Environmental Alliance. He is the winner of the 2014 Goldman Environmental Prize and joins us today to talk more about the environmental impacts on health in communities. Desmond, we look forward to having you join us.
Thank you, and good day to everyone out there in the US and all over the world. I'm quite happy to be on the panel and really appreciate that I'm given the opportunity to be able to speak about our lifetime work. Living in the shadow of the biggest chemical industry in South Africa on the East Coast, we know too well the risk and the danger of the petrochemical and chemical industry that spews out its pollution onto people's health and bodies on a regular basis. And this has been a work that I've managed to do for the last 25 years. This has been the high levels. We've had to learn about how do we take our own air samples, because when we started off, we knew that the children were affected with asthma and cancer and leukemia, but we didn't have the proof. So it was about building the proof. And what more than to get your own community surveillance, that we were able to take our own air samples, and the bucket comes out of California, in Richmond in California, brought to South Africa. So we were taught about the bucket. We still use the bucket all over the world to take our own air samples, and then we know exactly what chemicals are in the air, what we're breathing in at that given time. I'm a sniffer, so I can sniff all the chemicals alongside the fence line of the petrochemical and chemical industry. After 2 health studies showed that the rate of asthma was 53%, and that the asthma rate was escalating in the area. We also then, when we done the health study, we done a sample of the benzene, and we found that there was a high risk of cancer and leukemia, and that was growing. The norm is 1 in 100,000, but we had even at conservative figures, 25 in 100,000. So that information has been reviewed and peer-reviewed all over the world. It's in the medical journals. The air quality forced the government in South Africa to put in monitoring stations, where they're online monitoring stations where you can actually interpret the raw data and understand what are the chemicals being emitted by the big corporations, whether it's the petrochemical refineries, the paper mills, or even other chemical industries that are secondary industries to the petrochemical refinery. And just to say that this has led to the huge like you call it in the US, the Clean Air Act, but in South Africa, we call it the Air Quality Act. So that gave preference to the progressive constitutional right, where people must live in a clean and healthy environment. It's a progressive right that allows, if something goes wrong, you fix the problem now. Like so others, like we have seen, and having all the constitution is not good enough. It has to be implemented. And in the area, I've seen that even during the COVID period, your air pathways, when the pollution is out there, it opens your air pathways and you're affected even more. And recently, we've seen that a number of chemical companies had blown up in South Africa and north of where I live. And that was a chemical company that was housing pesticides, homicides, arsenic, and a host of other chemicals. Those chemicals ended up into the canals, into the rivers, and into the ocean. And tons of the marine life were killed. But also the beaches are all closed. So that company has been having huge investigations because people's health. People have suffered with breathing problems. People have suffered with skin diseases from the company. And so that has led to criminal charges by the government. For the first time in the history of the South African government, led to criminal charges because the company did not follow a due process of law, and no one knew that it was storing these nasty chemicals in those facilities. So people are affected, and it's happening all the time. What happens is that we took the bucket sample, we take water samples, and those samples are used to give us an indication of what chemicals are either in the water or chemicals in the air that we're breathing in. And we found that there were high levels of volatile organic compounds like benzene, toluene, and xylene. Those are nasty chemicals that are cancer-causing chemicals, which we call carcinogenic. In the water, we found that these chemicals were there as well. And that information is made available to the public. We then use a community surveillance document where we go door to door to find out what was the impact upon people's health and well-being. We find, in most cases, even in the schools, we find that the learners and the educators have been affected because all the schools are jettisoned in the middle of all these chemical companies. So when they pollute and they have an upset at the refinery or the chemical plant, it ultimately goes up and comes right down onto people to breathing, which has now resulted in a lot of children dying of leukemia. The cancer rate is quite high. We're burying people all the time, especially the elderly folks of brain cancer, prostate cancer, breast cancer. Those are common symptoms that people have been affected with. So with the result of that, we were able to, South Durban has had high levels of different chemicals, whether it's the sulfur dioxide, SO2, or whether it's the hydrogen sulfide, or whether it's benzene levels. But because of us taking our own air samples, community samples, able to challenge the government and bring that information to the notice of government, resulting in the petrochemical refineries in Durban reducing their sulfur content by over 60%. So if they were releasing 80% of the sulfur, they're now below 16%, which is still quite high, but it's much lower than what it's ever been. And then using that information, we are able to do the comparative studies of refineries in other parts of the world, whether it's in Denmark or whether it's in Rotterdam or whether it's even in the US, in Louisiana or Noco or Port Arthur, where I've been and seen the refineries. So we know that the refineries, wherever we go, whether it's in communities in the US, have a huge impact on people's health. And lots of people have been affected. And so we've used that information to good effect, where we have demanded government to ensure that the permits that they allocate for the petrochemical and chemical industry must be tightened up. So your scheduled trade permits and ensuring that the level of the chemicals being emitted at the refinery are completely right down to the lowest level. And so if they exceed the limits, we can force the government to prosecute. It wasn't there. It took many years for us to get to that situation. The health of the people has been devastating for us, and we've lost many loved ones because of that. By working together with the health authorities, the occupational health at the universities in Durban, we're able to ensure that the health problems that have been affected have been diagnosed, but more critically is that people are able to get the correct medication, so that at least they've got the medication and that's available for these health problems of asthma. Chronic asthma is not easy. They cost a lot of money if you go to private doctors or private facility. But in South Africa, government does. If you do go to the government facilities, you do get some sort of medical relief. So that's a bit of a positive spin. But just to say that we have had cancer walks. So October is the cancer month. So we've had cancer walks at the refineries, reminding them of the victims that people have been affected with the high doses of benzene, and as I said, all the other chemicals that have been emitted. We'd also have seminars in the communities on a regular basis, where we bring professionals and we get people that have cancer and asthma to come out and talk about their illnesses and to break the stigma and to get people to understand it. The other very important thing that we do here is also we develop support groups. So those who have been affected with cancer and leukemia and all, they have support groups where they can work together. They can find out from one another. They can have the right diet, eat the right food. And also what exercise do they need to do so that their bodies can get some relief. That has been for a number of years now that we've been doing that work, living in the shadow and seeing people dying of all these illnesses has really been horrific. But as much as we've seen people being affected, we've also seen that through the chemicals that are dumped in the rivers, in the canals, in the ocean, that the marine life has been affected. And we've analyzed some of the fish, and we found that high levels of mercury are in the fish. And you can imagine poor people who are unemployed, who fish for a livelihood, have to take home the fish and eat it and feed their families with fish, only to find that they're affected with their health because the fish contains heavy mercury. Most of your hazardous landfill sites are in poor neighborhoods. And all those all the slush from the hazardous site ends up into the river and into the canal and into your food chain. So that's become a major problem for us in South Africa. We continue to highlight all these and to create awareness amongst the communities inside, in every area where these hotspots are. And hence our notion of that the community must take their own air sampling, what we call the community surveillance. You can also take your own water sampling. It does cost a bit of money because you've got to send it to a laboratory, accredited laboratory, to get it analyzed. You also got to take the water samples and send it to a accredited laboratory there as well. So the different laboratories analyze for air and water. We used to send it to Columbus at one stage. The air bucket sample used to be analyzed in California, in Columbus, at Columbus University. And Dr. Wilma Subra was able to give us the results within 2 weeks, and we're able to understand it. But now we have credited laboratories in South Africa, so it's much cheaper, but still it costs money. So there's a lot that we've learned, and these samples and community devices work very well for us. In most cases, some of the government instruments that they have are not operational. And for convenience sake, when there's an explosion and a fire, they don't work at all. So in the absence of all that the community equipment that doesn't need any electricity or any energy can go out there And all you got to do is create a vacuum, take the air sample, send it off to the laboratory, and you'll get the results in the absence of all that. So we were able to show out that that the buckets and the community equipment and the information that we're using has created a huge awareness. The bucket sample is now with Public Lab in New York, and we're working with a group in California as well. So it's online. It's now a tool that's online. There's videos about it. There's teaching material. It's a simple tool that can bring the science to ordinary people. It makes you understand it, can be taught, and you can get to know what are the pollutants that are creating problems with your health. So it's online at Public Lab. People can get a hold of us. They can get a hold of me. We're training people all over the country. Of course, we certainly believe that the equipment is very user-friendly. It's easy to adapt, but more critically, you can get to know exactly what you breathe in when there are explosions and fires. And that has helped enormously to bring information to the ordinary people who might not necessarily understand the health impacts that they are affected with. So this has been a journey that I know works. Although it started in 2002 in the US, and the bucket has been brought to South Africa for us to take our own air samples. We use it now, and I can tell you, we've had to stand the test of the US EPA, and that passed the test in Louisiana and in Port Arthur. It had to stand the test of the South African State Oil Corporation, who said that this is not true. And we took joint samples, and then they found out that the air samples were the same. And the local government over the years has used the community bucket sample to prosecute some of the companies. So it's a tool that's easily and very friendly, and you can use it, and it works, and it's been used by local governments in South Africa to prosecute and to get a sense of what is in the air when people, these things sometimes happen at the middle of night, especially the explosions and fires from these chemical companies. They don't necessarily happen during the day. So at the middle of night, when these things are happening, the bucket sample goes out there, and we take the samples, and we're able to send it to the laboratories. And it's created huge awareness. Some of the information that we have developed is been taught in the curriculum in the schools in Durban. So in the schools, the secondary schools, we teach the learners about the chemicals. And so they decide what part they want to take on if they go to university. And this has been an eye-opener for the kids who now want to become scientists or chemical laboratory specialists, whatever other specialists in the field. They've used it to that effect. So it is something that we work with, and we're able to pinpoint who are the corporations that are responsible for the devastation on our health, which are the chemicals that come out of those corporations. So we've also written a book called The Toxic City. So we take all the information from each of these corporations and we turn into a book, and that's been also given to the learners and educators at the schools to use to understand what these chemicals are doing to our health and well-being and to our bodies. I'll take any questions. Thank you.
Thank you, Desmond. Thank you so much for sharing all of your incredible work. And we encourage you all to join Desmond in the virtual lounge after this session to ask him questions directly. And with that, I would like to introduce Diana. Diana has over 2 decades of experience in disability, international health, and human rights, and is a leading health advocate and founding executive director of the Disabilities Rights Fund and the Disability Rights Advocacy Fund. These organizations are shifting the paradigm that sees persons with disabilities as passive recipients for charity or medical intervention. They do so by participating in global mechanisms to ensure they are inclusive and to influence policies and official reports. advocating to development partners to include persons with disabilities in their agenda, and communicating innovations through stories that inspire and influence change makers, like she will be doing with us today. And with that, I would like to introduce Diana. Thank you.
Thanks, Megan, and thank you, Desmond. It was great to hear about your work. I spent a little bit of time looking at some of the previous lightning talks in this forum, and it seemed there's a really common story about individual entrepreneurs with good questions and kind of light bulb ideas. My story does share some of this, but it's also the story of a movement, actually two movements, that I've been honored to work alongside: the Global Disability Rights Movement and the Shift the Power movement in philanthropy towards participatory grant making. So both of these movements aim to advance overall well-being and broader societal health by increasing the participation of people with lived experience in decisions that affect them, including resource distribution. So what I'm going to talk to you about is really zooming out on the idea of health, and talking about the social determinants and the bigger picture of well-being in societies. And I'm able to be here speaking and sharing these movement stories with you because this venue is relatively more accessible to me as a white, educated, not visibly disabled person. Some of my closest colleagues, my board members, movement leaders would not be able to access this venue. I mean, I had trouble figuring out the tech. My colleagues who use screen readers because they're blind, or who need real-time captioners and sign language interpreters because they're deaf, simply could not access this space at all. This exclusion goes beyond the symbolic. My big question to all of us, and the question that underlies my work, is why are our solutions not inclusive? And when will this change? I've heard a lot over the last couple of days in this conference about how building resilient systems relies on data. So to gather some data, I'm going to ask Megan if she can run a poll. And here it is. What % of the global population has a disability? If you can mark what you think, is it 3%, 7%, 15%, 20%? We want to do this in real time so that I can get a sense of your knowledge. And do we get the results on the screen? I think you can just click what your thinking is on the little dot on the screen, and then we should be able to get the results. Is that right, Megan?
That's correct.
Okay, well, if as you're thinking about what % of the global population are people with disabilities, I will go ahead and let you know that according to the World Bank and the World Health Organization, the answer is C, is the third one here, 15%. That's 1 in every 7 people. And if you are a woman, 1 in every 5 people in the world. You can remove the poll if we're not getting responses. Thank you. My involvement in the disability rights movement started more than 20 years ago during the Kosovo crisis. As part of my work for the American Refugee Committee, I was helping some rather daring Macedonian mental health providers design a community-based mental health system instead of the institution-based system which was prevalent. I don't know if any of you remember the footage from orphanages in Romania after Ceausescu. The conditions were shocking. I saw children who had been tied to beds for years at a time so their limbs atrophied and they could no longer stand. I saw women who had been sexually assaulted by staff or patients, sometimes in the name of treatment. I saw men crowded into rooms so small that only some could lie down and sleep at any one time. The more I visited, the more I looked into these conditions and understood their trajectories. Once someone entered institutional care, it was a one-way street. Their legal capacity, their legal personhood was removed, and many exited only one way, through death. I was pretty horrified. My mother's family, Jews, all immigrated from Lithuania, and I was reminded of photos of death camps. The worst part of the experience for me, though, came when I tried to speak about the conditions to staff. Inevitably, I would get a response, something like, "Don't worry about it. They don't have the same feelings that we do." This dehumanization, this capacity to other, was what really riled me up and changed my life. I realized that this was not a health or a mental health issue. It was a human rights, a social justice issue. Over the next years, my work turned more and more towards the human rights of persons with disabilities. I ran the Russian and Eastern European programs of Doctors of the World, including a deinstitutionalization program for kids in Kosovo. I became the executive director of an organization now known as Validity. Then it was called the Mental Disability Advocacy Center, which takes cases to court against European and African governments for the abuse of people in institutions. As I was doing this, a global movement of activists with disabilities was starting to work at the United Nations in New York on an emerging treaty, the Convention on the Rights of Persons with Disabilities. This treaty became the fastest negotiated human rights treaty ever. Why? Well, the process of creating it was also the most participatory in UN history. Fully 1/3 of the working seats, the seats of the working group that drafted treaty text were reserved for civil society. Persons with disabilities who had a common principle and a common slogan, "Nothing about us without us." Desmond, you've probably heard that in South Africa, which is where it originated. Nothing about us without us. I was lucky to be able to participate in some of these meetings and to support one of my staff at the time, a well-known disability rights activist, Gabor Gombos, to participate in all of them, working specifically on what is now Article 12 of the CRPD, which underlines the legal capacity of all people with disabilities. The adoption of the convention in 2006 radically shifted the global paradigm about persons with disabilities from, as Megan said in my introduction, passive objects for pity, treatment, or charity to active, engaged citizens with rights. The treaty mandates the participation of people with disabilities in the achievement of rights, whatever rights they are, including health rights. Watching activists with disabilities make this treaty happen at the UN and truly writing into human rights law the principle "nothing about us without us" was incredible. But I and many others had a persistent question. Where were the resources to support activists on the ground to advocate to their governments to ratify and implement this treaty? Back in the mid-2000s, disability was still not seen by global human rights or development funders or even movement actors as a rights issue. Too often, that is still the case. This lack of recognition of disability as a rights issue and a lack of resources for disability rights activists was both a gap and an opportunity that led to the founding of my organization, the Disability Rights Fund, which I launched in 2008. Fast forward, since launch, we have raised around $70 million, including from governments, the UK and Australia, and some of the largest human rights foundations, Open Society, Ford Foundation, Wellspring, and we've given out nearly 60% of that in grants to over 400 organizations of persons with disabilities in 34 countries, all for their rights advocacy work. How did we get here? Participation. Early on, I spent nearly a year in dialogue with activists with disabilities from around the globe and with donors to develop a framework for the fund. never having been a grant maker and not knowing how to do grant making actually turned out to be an advantage. I was able to look at innovative models like Global Green Grants and the HIV Collaborative Fund that incorporated activists into decision making. This structure made sense to me. How could a fund aimed at realizing the convention, which mandated participation, be successful without participation? Indeed, how can human rights work be successful without participation? The framework for the fund included persons with disabilities at all levels: governance, advisory, staffing. Getting initial buy-in to this model and convincing donors of its effectiveness has been a journey. I still remember a first key meeting of the fund where activists with disabilities presented their ideas for funding priorities, size of grants, accessibility for diversity of persons with disabilities, and founding donors realizing at that moment that despite their best intentions, they had none of this information and they really needed it. Now we have a board which is 50% persons with disabilities and co-chaired by a person with disability. We have a grant-making committee which is majority activists with disabilities. The grant-making committee also includes 4 seats for donors. So there is a way for donors to continue to learn from disability activists and vice versa. And our staff globally are majority persons with disabilities. This participatory structure enables us to continuously iterate based on the needs of the movements in the countries where we work. So what is the impact and how do we measure it on persons with disabilities and on philanthropy? Well, we are the very first donor to most of our grantees. This alone is a huge impact. We are providing resources for participation and belief in participation in a way that simply has never been there for people with disabilities before. Since the launch of the fund, we have made grants that have enabled persons with disabilities to amend or develop close to 300 laws and policies at national and local levels in Bangladesh, Peru, Indonesia, Uganda, Ghana, Malawi. These are frameworks for systems change that will potentially improve the lives of millions. We closely track participation of people with disabilities in these processes over time, from initial stages of drafting to advocacy to ministries and parliament, to awareness raising with public, to creation of regulatory frameworks, budgets, and monitoring mechanisms. We also track to whom our funding goes. Of course, there are hierarchies of power in every movement. In the disability movement, it is the urban, educated men with physical disabilities and blindness who have the advantage. So we make sure that 50% of our grants go to those groups marginalized even within the disability movement, like women with disabilities and Indigenous people with disabilities. This has helped to shift movement dynamics and power structures. In Indonesia, the National Organization of Women with Disabilities was the leader in advocacy for successful passage of the country's first National Disability Act. In Rwanda, we were the first funder to the first Organization of Women with Disabilities, UNABU. Since 2015, they have been able to grow their donors and staff tenfold, making it possible for them to now support 8,000 women and girls with disabilities across Rwanda. This growth positioned them to lead on inclusive gender-based violence response nationwide during the COVID-19 pandemic. As the founder of UNABU, Gaudens, stated, DRF invested in technical assistance, supported us to collect evidence, linked us to new opportunities, included us in global events. These investments have increased our visibility and led to national and international recognition. During the pandemic, our closeness to community allowed us to rapidly shift our resources to organization and activist sustainability, as well as support for COVID-specific advocacy. The pandemic has disproportionately negatively affected persons with disabilities around the world, especially people with disabilities with other marginalized identities, making already tough access to health and education even tougher, and putting women with disabilities at even higher risk for violence. Yet we found that our years of supporting advocacy to government by our grantees was key to critical successes in ensuring that public health communications and official announcements are being made with sign language interpreters and in other accessible ways in Samoa and in Indonesia, in ensuring persons with disabilities are being prioritized for vaccinations in Rwanda and in Nigeria, and in including persons with disabilities in social protection measures in Haiti, and finally, in ensuring that police protection is accessible to women with disabilities in Indonesia, Rwanda, Malawi, where grantees have developed memorandums of understanding with police for training in disability inclusion and have disability desks in police stations. We've also had an impact on how funders think. With our influence, Candid and the Human Rights Funders Network now track human rights funding going to persons with disabilities. And major donors are changing the way they operate. It was really exciting to me to see the announcement earlier this week from Ford Foundation of the opening of their first US disability rights program with a budget of $10 million. Our participatory grant-making model, which has shifted power and decisions about where money goes to people with lived experience, has been documented and built on extensively. You can read more about our impact in Grant Craft's guide, Deciding Together, Shifting Power and Resources, and in a recent book by Meg Massey and Ben Global, Letting Go, How Philanthropists and Impact Investors Can Do More Good by Giving Up Control. You can also learn more at a new participatory grant-making community of practice that we've been building with others that you can find at participatorygrantmaking.org. So I would like to conclude by asking all of you, are we being daring enough? Are we being inclusive enough? Do we have the right people at the table? And by asking you to look at everything that you are doing, to ask yourselves if you are finding ways to include people with disabilities. Thank you.
Thank you so much, Diana. And I think that is a great tee off to having and continuing these conversations with you both in the social lounge. So Diana and Desmond, thank you so much for joining us. We now invite you all to join them in the social lounge for more Q&A and just direct conversation. So once this session ends, please make your way to the social lounge. At the virtual tables, you will see one named for each of our speakers. So Diana and Desmond, thank you both once again.
Thank you. Thank you, Megan.
Thank you.